Today we're talking about something a lot of people deal with, but nobody really wants to talk about: hemorrhoids. Yep, we're going there. It's one of those health issues that can cause a lot of discomfort, frustration, and even a bit of embarrassment. But the truth is, there's nothing to be ashamed of. Millions of people experience hemorrhoids, and the more we know, the better we can manage them and even prevent them. So let's break down the stigma and get straight to the facts, because you deserve to have this information. What causes them? What do they feel like? And more importantly, how can you get rid of them fast and prevent them from coming back? We'll cover the nitty-gritty details, from the different types of hemorrhoids to the common culprits behind their appearance. We'll also explore the various symptoms so you can identify if this is what you're experiencing. And then, most crucially, we'll look at effective home remedies and discuss when it's time to see a doctor. Whether you're suffering right now or just want to be prepared, stick around. This could really help you. All right, let's start with the absolute basics. What exactly are hemorrhoids? It's a term you've probably heard, maybe even winced at, but understanding the fundamentals is key to tackling the issue. Essentially, hemorrhoids are swollen veins located in the lower part of your rectum and around your anus. Think of them as being somewhat similar to varicose veins, those swollen, twisted veins you might see on someone's legs. But these, of course, are in a much more sensitive and private area. This swelling occurs when there's increased pressure on these veins, causing them to bulge and become irritated. These swollen veins can be a real nuisance, leading to discomfort, pain, and sometimes bleeding. It's important to realize that these are a part of our normal anatomy. They are cushions of tissue filled with blood vessels. The problem arises when they become enlarged and symptomatic. We all have hemorrhoidal tissue, but it's when this tissue gets inflamed or swollen that we start referring to them as hemorrhoids in the problematic sense. So it's not about something foreign appearing, but rather a part of you becoming inflamed due to certain pressures or conditions. Now, it's important to know that not all hemorrhoids are created equal. There are primarily two types, and their location determines their classification and often the symptoms you might experience. First, we have internal hemorrhoids. As the name suggests, these form inside the rectum, the final section of your large intestine, terminating at the anus. Because this area has fewer pain-sensing nerves, internal hemorrhoids are often painless, which might sound like a good thing, but it also means you might not even know you have them unless they cause bleeding. You might notice bright red blood on the toilet paper or in the toilet bowl after a bowel movement. That's a common sign of internal hemorrhoids. Sometimes an internal hemorrhoid can prolapse, meaning it enlarges and protrudes outside the anal sphincter. If this happens, it can become quite painful and irritated, especially if it gets trapped or thrombosed. We'll talk more about thrombosis a bit later, but it's essentially when a blood clot forms within the hemorrhoid, causing significant pain. Understanding this distinction is key for diagnosis and treatment. Then we have external hemorrhoids. These develop under the skin around the anus. This area is rich in nerve endings, so external hemorrhoids can be particularly uncomfortable. They are the ones that often cause the symptoms people most commonly associate with hemorrhoids: significant pain, itching, and a general feeling of irritation in the anal region. You might even be able to feel them as a sensitive lump or swelling around the anus, especially if they become inflamed or irritated. Sometimes an external hemorrhoid can develop a blood clot inside it, a condition known as a thrombosed external hemorrhoid. This can lead to sudden severe pain, and the lump can become hard, swollen, and quite tender to the touch. It might look bluish or purplish due to the clotted blood. While alarming, it's usually not dangerous, but it can be incredibly painful and might require medical attention for relief. So, the location, internal versus external, really dictates a lot about what you might feel. And just to emphasize how common these are, statistics show that nearly 3 out of every 4 adults will experience hemorrhoids at some point in their lives. So, if you're dealing with this, please know you are far from alone. It's a widespread condition, affecting people of all ages, genders, and backgrounds. The prevalence increases with age, often peaking between 45 and 65, but younger people, including pregnant individuals, can certainly develop them too. This isn't some rare, obscure ailment. It's a very human experience. So now that we know what hemorrhoids are, the next big question is, what causes them to develop in the first place? Understanding the root causes is absolutely crucial because it empowers us to make changes that can prevent them or stop them from getting worse. The primary theme, as I mentioned earlier, revolves around increased pressure in the veins of your lower rectum and anus, Think of it like overinflating a balloon. Too much pressure and things start to bulge. One of a major culprit, and perhaps the most commonly discussed, is straining during bowel movements. This often happens when you're constipated and trying to pass hard, dry stools. When you bear down and strain, you're significantly increasing the pressure within your abdominal cavity, and this pressure is transmitted to the veins in your rectal area. Over time, this repeated straining can cause those veins to swell and stretch, leading to the formation of hemorrhoids. It's a direct cause and effect relationship that many people unfortunately experience. Another significant factor is sitting for long periods, especially on the toilet. Yes, I'm talking to those of you who take your phone into the bathroom for an extended scrolling session. When you sit on the toilet, particularly for more than a few minutes, the design of the toilet seat can cause the anorectal area to hang lower, allowing blood to pool in the hemorrhoidal veins. This pooling increases pressure and can contribute to their development or exacerbation. So your bathroom break shouldn't turn into a library visit or a social media catch-up session. Pregnancy is another common trigger for hemorrhoids. There are a couple of reasons for this. Firstly, the growing uterus puts increased pressure on the veins in the pelvic area, including the rectal veins. Secondly, hormonal changes during pregnancy can cause veins to relax and dilate more easily, making them more susceptible to swelling. Constipation, which is also common during pregnancy, further compounds the problem by leading to straining. Many women experience hemorrhoids for the first time during pregnancy or postpartum. Obesity or being significantly overweight can also play a role. Extra body weight, particularly around the abdomen, adds to the overall pressure on the pelvic and rectal veins, similar to the effect of pregnancy. This chronic increase in pressure can weaken the vein walls over time, making them more prone to bulging and becoming hemorrhoids. Maintaining a healthy weight is therefore beneficial, not just for your overall cardiovascular health, but also for preventing this specific type of discomfort. A low-fiber diet is a huge contributor, primarily because it often leads to constipation. Fiber is essential for keeping your stools soft and bulky, allowing them to pass easily through your digestive system without the need for straining. When your diet lacks sufficient fiber from fruits, vegetables, and whole grains, your stools are more likely to be hard and difficult to pass, which brings us right back to the problem of straining during bowel movements. It's a vicious cycle that can be broken with dietary adjustments. Basically, anything that consistently increases pressure in your lower rectum can cause or worsen hemorrhoids. This could also include chronic coughing or sneezing, or even lifting heavy objects improperly on a regular basis, as these activities also increase intra-abdominal pressure. Understanding these triggers is the first step toward prevention. If you can identify and mitigate these pressure-inducing factors in your daily life, you're well on your way to keeping hemorrhoids at bay or managing them more effectively if they do occur. Okay, we've covered what hemorrhoids are and what causes them. Now, let's talk about how you might know if you actually have them. Recognizing the symptoms early can help you seek relief faster and prevent complications. The symptoms can vary quite a bit, depending on whether the hemorrhoids are internal or external, and also on their severity. Some people might have very mild symptoms, while others experience significant discomfort that impacts their daily life. One of the most common symptoms, especially with external hemorrhoids, is pain or discomfort, particularly during or after bowel movements. This pain can range from a dull ache to a sharp, throbbing sensation. You might also feel a general soreness or tenderness in the anal area. For internal hemorrhoids, pain is less common unless they prolapse and become irritated or thrombosed. But for external ones, pain is often a primary complaint that sends people looking for answers and relief. Itching or irritation around the anus, medically known as pruritus ani, is another very frequent symptom. This itching can be incredibly persistent and bothersome, sometimes leading to a strong urge to scratch, which can further irritate the sensitive skin and worsen the inflammation. The itching might be caused by the swollen hemorrhoids themselves, by mucus discharge from internal hemorrhoids irritating the skin, or by difficulty in keeping the area clean due to the swelling. It's a really frustrating symptom for many. You might also notice swelling or feel a sensitive lump near your anus. This is characteristic of external hemorrhoids or a prolapsed internal hemorrhoid. The lump can vary in size from as small as a pea to as large as a grape. It might be soft, or if it's a thrombosed hemorrhoid, one with a blood clot, it can feel quite hard and be exquisitely tender to the touch. Sometimes this lump can make sitting uncomfortable or make wiping after a bowel movement difficult and painful. Perhaps one of the most alarming symptoms, though often not serious when related to hemorrhoids, is seeing bright red blood. This blood typically appears on the toilet paper after wiping, or you might see a few drops in the toilet bowl. This bleeding is usually associated with internal hemorrhoids, as the fragile surface of these swollen veins can be easily damaged by passing stool. The blood is bright red because it's fresh, coming from the very end of your digestive tract. It's incredibly important to emphasize this next point. If you ever see rectal bleeding, please do not just assume it's hemorrhoids and ignore it. While hemorrhoids are a common cause of bright red rectal bleeding, other more serious conditions, such as anal fissures, colitis, diverticulosis, polyps, or even colorectal cancer, can also cause similar symptoms. It is always best to get any rectal bleeding checked out by your doctor to get an accurate diagnosis and rule out these other possibilities. Your doctor can perform an examination and, if necessary, recommend further tests. So, to recap the common signs, pain or discomfort, especially with bowel movements, itching or irritation in the anal region, a noticeable swelling or a sensitive lump near the anus, and bright red blood on toilet paper or in the toilet. If you're experiencing any of these, it's a good idea to pay attention and consider the possibility of hemorrhoids. And remember, that talk with your doctor about rectal bleeding is non-negotiable for your peace of mind and health. Don't delay getting it checked. Chapter 4. Relief is here. Effective home treatments for hemorrhoids. Now for the part many of you have been waiting for, how to get relief from hemorrhoid symptoms, especially with things you can do right at home. The good news is that for many mild to moderate cases, home remedies can be very effective in reducing pain, swelling, and itching, and helping the hemorrhoids to heal. These strategies focus on soothing the area, reducing inflammation, and making bowel movements less traumatic for the already irritated tissues. One of the most highly recommended and effective home treatments is taking warm sitz baths. A sitz bath involves soaking your anal area in plain, warm water, not hot, just comfortably warm, for about 10 to 15 minutes, several times a day. This is especially beneficial after bowel movements. The warm water helps to soothe the irritation, reduce inflammation, and can relax the anal sphincter muscle, which can ease pain. You can use a special sitz bath basin that fits over your toilet, or simply sit in a bathtub with a few inches of warm water. To help reduce swelling and numb the area a bit, you can try applying a cold compress or an ice pack. Wrap the ice pack in a thin cloth to protect your skin, and apply it to the affected anal area for about 10 to 15 minutes at a time, a few times a day. The cold helps to constrict the blood vessels, which can reduce swelling and provide temporary relief from pain and itching. Just be careful not to apply ice directly to the skin for too long, as it can cause an ice burn. There are also various over-the-counter creams, ointments, suppositories, or pads that can provide temporary relief from hemorrhoid symptoms. Look for products containing ingredients like hydrocortisone, which can reduce inflammation and itching, or witch hazel, which has astringent properties and can help soothe irritation and shrink tissues. Some products may also contain local anesthetics like lidocaine to numb pain. Always use these products as directed and not for more than a week, unless advised by your doctor, as prolonged use of some ingredients can cause skin thinning. As we discussed in the causes, fiber is your friend. Eating more fiber-rich foods like fruits, pears, apples, berries, vegetables, broccoli, Brussels sprouts, leafy greens, and whole grains, oats, brown rice, whole wheat bread is crucial. Fiber softens your stools and adds bulk, making them easier to pass and reducing the need to strain. Aim for 25 to 35 grams of fiber per day. If you find it difficult to get enough fiber through diet alone, you can consider a fiber supplement like psyllium husk, but start slowly and increase gradually to avoid gas and bloating. Alongside fiber, staying well hydrated is absolutely essential. Drinking plenty of water, aim for at least 8 glasses a day, or more if you're active or in a hot climate, helps to keep your stool soft and prevents constipation. When you're dehydrated, your body pulls water from your colon, resulting in harder stools that are more difficult to pass, which, as we know, leads to straining and can aggravate hemorrhoids. So keep that water bottle handy and sip throughout the day. Finally, and this is a big one, try your best not to strain during bowel movements and avoid sitting on the toilet for prolonged periods. When you feel the urge to go promptly. Don't hold it in, as this can make stools harder. Once you're on the toilet, try to relax and let things happen naturally without excessive pushing. And as we mentioned earlier, limit your time in the bathroom. It's not the place for extended reading or phone use. Keep those bathroom visits quick and focused on the task at hand to minimize pressure on those sensitive veins. Chapter 5. Don't tough it out. Knowing when medical help is necessary. While home care strategies are often very effective for managing mild hemorrhoids, it's really important to know when it's time to stop self-treating and seek advice from a doctor. Sometimes hemorrhoids can be more severe, or the symptoms might indicate something else entirely. Ignoring persistent or worsening symptoms can lead to unnecessary suffering and potential complications, so recognizing these red flags is key for your well-being. One clear sign that you need to see a doctor is if your symptoms don't improve after about a week of consistent home care. If you've been diligent with sitz baths, fiber, hydration, and over-the-counter remedies, but the pain, itching, or swelling isn't getting any better, or perhaps is even getting worse, it's time for a professional evaluation. Your doctor can confirm if it's indeed hemorrhoids and recommend stronger treatments or investigate other potential causes for your symptoms. If you experience severe pain or significant bleeding, don't wait a week. Seek medical attention more promptly. While some discomfort is common with hemorrhoids, intense, unbearable pain, especially if it comes on suddenly, could indicate a thrombosed hemorrhoid, which might benefit from medical intervention to relieve the pressure. Similarly, while a little bright red blood on toilet paper can be typical, if you're noticing a lot of blood or if bleeding is frequent, it absolutely needs to be checked out by a healthcare professional. Another reason to consult your doctor is if you feel a lump near your anus that is very painful, doesn't go away, or seems to be growing. This could be a thrombosed external hemorrhoid, as mentioned, or it could be something else that needs diagnosis. A doctor can examine the lump and determine the best course of action. Trying to tough out severe pain from a thrombosed hemorrhoid is often a miserable experience, and there are procedures that can offer rapid relief. Also, pay close attention to the color of any blood or your stools. If you notice blood that is dark red, maroon, or black, or if your stools look tarry, this is a definite signal to see your doctor immediately. Bright red blood usually indicates bleeding from the lower gastrointestinal tract, like hemorrhoids, but darker blood or tarry stools can suggest bleeding higher up in your digestive system, which can be a sign of a more serious condition and requires urgent medical assessment. When home remedies aren't enough, or for more persistent or severe hemorrhoids, doctors can offer a range of minimally invasive procedures. These are often done in the doctor's office. One common option is rubber band ligation, where a small rubber band is placed around the base of an internal hemorrhoid to cut off its blood supply, causing it to shrink and fall off within a week or so. It's generally effective for internal hemorrhoids. Other medical treatments include infrared coagulation, also called photocoagulation, where an infrared light is used to create scar tissue and cut off blood flow to the hemorrhoid. Sclerotherapy involves injecting a chemical solution into an internal hemorrhoid, which causes it to shrink. For very large, persistent, or severely symptomatic hemorrhoids, especially those that haven't responded to other treatments, surgical removal, known as a hemorrhoidectomy, might be considered as a last resort. Your doctor will discuss the best options for your specific situation. Chapter 6. Keeping hemorrhoids at bay, your prevention playbook. We've talked a lot about what hemorrhoids are, what causes them, their symptoms, and how to treat them. But perhaps the most empowering knowledge is how to prevent them from occurring in the first place, or from coming back if you've already experienced them. Because trust me, as many who've had them can attest, once you've dealt with the discomfort of hemorrhoids, you'll want to do everything you can to avoid a repeat performance. Prevention really is the best medicine here. The cornerstone of hemorrhoid prevention is, unsurprisingly, maintaining soft, easy-to-pass stools, and the best way to achieve this is by eating a high-fiber diet. I know we've mentioned this in the context of treatment, but it's doubly important for prevention. Consistently including plenty of fruits, vegetables, legumes, and whole grains in your daily meals helps to ensure your digestive system runs smoothly. This reduces the likelihood of constipation and the subsequent straining that puts pressure on those rectal veins. Make fiber a non-negotiable part of your eating habits. Hand in hand with a high-fiber diet is drinking lots of water and other fluids. Adequate hydration is crucial for keeping your stools soft. When you don't drink enough, your colon absorbs more water from your waste, making stools hard, dry, and difficult to pass. Aim for that target of at least 8 glasses of water a day, and possibly more if you're exercising or if the weather is hot. Think of water as the lubricant for your digestive system. It helps everything move along as it should. Regular physical activity is also beneficial for preventing hemorrhoids. Exercise helps to stimulate bowel function, reducing the chances of constipation. It also improves circulation throughout your body, including in the rectal area, which can help prevent blood from pooling in the veins. You don't need to become a marathon runner. Even moderate exercise like brisk walking for 30 minutes most days of the week can make a significant difference to your digestive health and overall well-being. A simple but effective preventative habit is to go to the bathroom when you feel the urge. Don't delay your bowel movements. When you hold it in, the stool can become harder and drier, as more water is absorbed from it in the colon, making it more difficult to pass later on and increasing the need to strain. So when nature calls, try to answer it as promptly as is practical. Listen to your body's signals. Another key preventative measure is to avoid sitting for excessively long periods, especially on the toilet. If your job involves a lot of sitting, try to take short breaks every hour to stand up, stretch, and walk around. This helps to relieve the constant pressure on your rectal veins. And, as we've emphasized before, make a conscious effort to limit your time spent sitting on the toilet. No more long reading sessions or endless scrolling on your phone in the bathroom. It really does contribute to the problem. And yes, to specifically reiterate that last point because it's such a common habit in our modern lives, seriously consider limiting your phone time in the bathroom. It's easy to lose track of time when you're engrossed in your device, leading to prolonged sitting on the toilet, which, as we know, increases pressure on hemorrhoidal veins. Making the bathroom a phone-free zone, or at least a quick-use-only zone for your phone, can be a surprisingly effective preventative step. It's about being mindful of those little habits that can have a big impact. Wrapping up your hemorrhoid action plan. So there you have it, a comprehensive look at everything you hopefully need to know about hemorrhoids. What causes them, the common symptoms to watch out for, effective home treatments that can bring relief when it's crucial to see a doctor, and most importantly, practical tips on how to prevent them from becoming a painful problem in your life. I know it's a sensitive topic, but I truly hope breaking it down like this has made it more understandable and less intimidating for you. If you found this video helpful, and I sincerely hope you did, please hit that like button. It genuinely helps to support the channel and allows us to reach more people who might be looking for this kind of straightforward health information. And if you have any questions that weren't covered, or perhaps you have your own tips or remedies that have worked well for you in managing hemorrhoids, please don't hesitate to drop them in the comments section below. We're all here to learn from each other and build a supportive community. And of course, don't forget to subscribe to Mulualem Kiros and hit that notification bell so you don't miss out on more easy-to-understand health tips and discussions coming your way. We're committed to providing you with reliable information to help you take control of your health. Thanks so much for watching today. Take care of yourself, be kind to your body, and yes, your backside too. Stay healthy, everyone.